Hey, Dr. Van Duzen here. I want to show you how to use a sinus rinse. So these are great things to do for allergy symptoms, for sinus symptoms, and something I really want you to do at least a few times a day after any nasal or sinus procedures. So you're going to have a rinse bottle. This is the one we usually recommend. It's a squeeze version of the neti pot. So this is the Neomed sinus rinse bottle. You're going to have salt packets. So these you can buy just at any grocery store or pharmacy. And then you're going to use distilled water. Purified water can be okay. You can boil water and let it cool. You just don't really want to use tap water. So we're going to get our bottle ready here. I'm going to put the salt packet in first. I frequently will prescribe some medicine that you'll also add to this rinse. So that medicine, sometimes if it comes from a compounding pharmacy, it's going to be in a capsule. If it comes from the regular pharmacy, it might be in a little plastic vial and it's liquid, and you will add that with the salt packet. So use the salt packet and the medicine if I prescribed it. And we're going to add our distilled water. I'm going to just pour it up to the line. It's 8 ounces of water. And I typically would microwave this till it's lukewarm. So it depends on your microwave, but maybe 20 or 30 seconds we're going to microwave it for. You don't want it to be hot, but you don't want it to be cold either. This is going to be a little chilly, but I'm still going to do it. So you kind of shake it up with the medicine and the salt in there. And then you're going to gently insert it in one nostril. You're going to hang over a sink, or some people do it in the shower, and you're going to watch it come out the other side. So here we go. We're going to do it, and then have some Kleenex ready or some paper towels ready. So we're going to hang over the sink, insert it, breathe through your mouth. So you do about half the bottle in one side, and it's okay to alternate. So if you want to do, a quarter of the bottle, switch sides, a quarter of the bottle, and go back and forth, you can do that. And now we're going to do the other side. Good. Oh, it feels so good. But again, this is cold. If it's lukewarm, it usually doesn't feel bad. After surgery, you're going to see thick mucus come out or blood come out. If you're kind of dealing with or treating a sinus infection, you're going to see a lot of mucus come out, which is great. That's stuff that's not coming out just when you blow your nose. And then, like happening to me right now, sometimes after you do a rinse, you're just hanging out later, or you bend over to put your shoes on or something, you might get all of a sudden some rinse come out. That's super normal. Again, that can happen whether you've had surgery or not. So don't be surprised if all of a sudden some extra rinse comes out. But this is super helpful to do. So especially if you've had surgery, you want to do this at least 3 times a day, starting the day after surgery. But again, it can be great for treating sinus infections, allergy symptoms. If you have questions about the technique or the medicines that we sometimes prescribe, just reach out.